I put this slide here because I thought it was just as good as any other place to sort of describe the different metal levels within the marketplace. And as I had mentioned in the slides previously, that to be eligible for the marketplace, you really just need to be a U.S. citizen and to live in the U.S. This here just breaks down the difference between the different metal level plans. And that the main difference really is just the cost sharing breakdown. So how much you pay and your health insurer will pay. So you have the platinum plans, really that's insurance pays majority of the medical costs, and there's the breakdown there, 10% of your medical costs, and then it goes all the way down to the gold plans, silver plans, bronze plans, and then you have the catastrophic plans where the insurance pays less than 60% of your medical costs and you can pay more than 50% of your medical costs. I also want to note that I think one of the big questions when people are determining whether or not they're eligible for the marketplace plans is, can I afford it? I think that's one of the big questions that they ask. And healthcare.gov does assist people to determine whether or not a person may be eligible for tax subsidies or tax credit to help pay for those monthly premiums. So yes. So the question that was asked was whether or not these different metal levels would yield different network structures and different benefits. And I think the short answer to that is yes. Pat, I don't know if you want to explain a little bit more. I was planning to go a little bit more detail about network structure, but certainly if you have anything else to add, feel free to chime in.
I think the one thing about the different plans, each one of them carry a different premium. So that's one of the first things you want to look at. And they do have different provider networks. But when you select one of the plans, it'll bring up all of the options within that category in your zip code. And you can go in and actually on healthcare.gov, it lets you insert the name of your physician. It'll tell you if that physician is covered under that plan. It'll also allow you any medications that you're on to put that in so you can see if it's on their drug formulary. But the big deal is that each one of the plans, the bronze, silver, gold, and platinum, will have different deductibles associated with it, different premiums associated with it, and different provider networks potentially. And even if you, when you select it before you actually sign up for it, you'd want to check with your actual provider and make sure that they're still participating in that plan. But it goes through all the different, like there could be United Health plans, Aetna plans, whatever is in your area, what the big carriers, Blue Cross is, and it'll tell you exactly what it is. So you want to check on each one of the plans to make sure your providers are in that network. Catastrophic was intended for those people who, at the time it was the young people who felt they were did not need insurance, and so it was intended to be a very minimal insurance for truly if you had a big diagnosis or something happened to you. It has a high deductible before the plan would ever even start to cover anything. So the benefits were much more limited, but that's kind of my thing on it.
Okay, thank you, Pat. And again, we are here to answer any more specific questions related to this, but Pat, I think you did an excellent job of describing this. And I know there were probably a lot of terms that were said, deductible, premium, network, and you all may be familiar with it. Some of you may not be, so we'll be sure to define those terms for you as we go forward. So let's see here. Okay, all right. So in addition to the different types of coverage that is available, there are different plan types that fall within each of those. And you all should have received this if you haven't already. It's a handout that describes just the different types of plans. So you can have anything from an exclusive provider organization plan, a fee-for-service plan, and point-of-service plan. And I highly encourage you all to read this. I'm going to focus on just the two plans that people hear most frequently, which are the health maintenance organization plans, as well as the preferred provider organization plans. So the HMOs and the PPOs. Are you familiar with those acronyms, or have you heard them before? So the best way I think to describe the difference between health maintenance organizations, or HMOs, versus PPOs is to, best way to explain it to you is to really use an example. So I think the way I see, or the way I feel health maintenance organizations, or HMOs, are structured, or they tend to follow a gatekeeper model. So you have a primary care physician that serves as that gatekeeper. So for the example I'll use is, say I have an HMO plan, and I need to see a dermatologist. I would need to go to my primary care provider first before I can see a dermatologist, and would need to get a referral from my primary care provider to determine or to eventually see that dermatologist. In a PPO network, I could very well have the choice that I want. If I can either go about it two ways. I can go online and go through my insurance plan website and see what sort of dermatologists that they cover, or I can just look up dermatologists on my own and determine whether or not they accept my insurance. So that's really, I would say, is the main difference. And I think what I just really want to emphasize here with the HMO plans is that it generally won't cover out-of-network care unless it's an emergency. And most HMOs provide integrated care that focus on prevention and wellness. So those of you in the room, are you familiar with Kaiser Permanente? So Kaiser is an HMO. Military plans like TRICARE and the VA function in this way as well. PPOs, you often are the ones that you probably hear most commonly. A lot of the federal plans, like the Blue Cross Blue Shield Federal, or PPOs, and generally you pay less if you use providers that are in the plan's network. All right, so now going into plan designs, there was a question about networks and what that means. And so I feel like we're getting just deeper into insurance, and I know it can get confusing. So networks is really what you need to consider when thinking of plan design. So you think of how you get your insurance. You can either get through your employer, through the marketplace, or either through Medicare or Medicaid. Within that, there are options between HMOs and PPOs, and then now, and as well as other plan types. But now you're looking into plan designs, and really what that means is the network, what makes up the group of doctors that are covered within that insurance. And John asked that question of, does the network change based on the different metal levels? And the answer is yes. And it differs really between how an insurer decides to structure their network. And so what determines that is a contract that insurers they look within, a certain area. They see what, what hospitals are there, what providers are there, and they determine the structure of their network based on that. Sometimes you'll have networks that are incredibly comprehensive. That's typically what you see in the PPO plans. Sometimes you have networks that are narrow. And really what this refers to are plans that have a limited choice of healthcare providers, but you pay a lower premium. So a lower monthly payment to get that plan. And so to use the example to use the example of the, let's see, of the dermatologist again, if I had a narrow network plan, then I may not be able to or if I wanted to see a dermatologist, that dermatologist could very well be out of network, and I would have to pay more out of pocket, or because the insurance wouldn't cover that. Does that make sense? And so typically we see narrow networks with high deductible health plans. And again, high deductible health plans are pretty appealing to younger people because you pay a lower monthly premium. That lower monthly premium is what people tend to gravitate towards. It's very attractive, but unknowingly they may get a plan that doesn't include a lot of the doctors that they need. And so they may end up having to pay more in the long run. It can be much higher than that. And it's really dependent on the insurance and what they determine that to be.